Heck Doc. Hey Abby, how we doing
Hello.
today?
Good, how are you?
Good. What's bringing you in today?
Just a general checkup.
General checkup? Okay, so it looks like on the agenda today we're going to be doing a head, neck, ears, nose, throat, and mouth assessment along with the skin assessment, okay? So let's get started. We're going to start with your head. I'm going to go ahead and inspect it here. Your head appears to be normocephalic. I'm going to go ahead and palpate here for any types of lesions or trauma. There appears to be no lesions or trauma. Your head is appropriate in size. Your face is symmetrical and is normal pigmentation for race and ethnicity, and I do not note any tics. We're gonna go ahead and move on to your sinuses. We're gonna palpate your frontal. Just let me know if you have any tenderness.
Nope.
We're gonna do your maxillary.
No.
You're gonna feel my hands right here. I want you to open and close your jaw. Any pain?
No.
Good. No TMJ pain. We're gonna move on to your hair and nails. Your hair appears to be brown. It is well distributed. It is smooth. I'm inspecting your hair here for any ticks, lice, or dandruff, which there appears to be none noted. We're gonna move down to your nails. Pardon me. Your pigmentation is a pinkish tan color. The length appears to be well kept. The surface there is no redness, swelling, pain, or exudate noted, and I do not see any warts, cysts, or tumor growth. Next, we're gonna assess for clubbing. I just want you to do this for me. Go into the next nail, next nail, next nail. Good, there appears to be no clubbing. I'm gonna assess your capillary refill here. Capillary refill is less than 3 seconds. Your nails are smooth and shiny. They are of appropriate thickness and have a well nail bed adherence. Your cuticle colors are a pinkish white, so there is no concern for vascular compromise. We're gonna move on to your skin assessment now. Pardon me. Generalized skin assessment. The patient has a pinkish skin color that is appropriate for her race. It is uniform and symmetric throughout. She appears to be of good hygiene. She does have some primary lesions noted on her upper extremities. Most notable, a macule on her left forearm. It is symmetrical. The borders are well approximated. The color is brown and brown throughout. The diameter appears to be about 3 millimeters by 3 millimeters. It is not elevated. The texture is smooth, and there is no evolution noted. There's also no exudate coming from her skin that I'm able to visualize. And she does appear to have a secondary lesions to her cheeks, possibly secondary to acne. It would be an atrophic scarring. Do you have a history of having acne?
Mm-hmm.
Okay, I'm gonna have you lift your shirt up a little bit here for me. I'm gonna use the dorsal surface of my hands and we're gonna assess it here. Skin is warm, dry, smooth, and intact throughout. The patient does have a tattoo noted to her left forearm. It is well kept. It is clean, dry, intact. There is no swelling noted. The patient also has a tattoo to her right upper thigh. It appears well healed. It is clean, dry, and intact, and there appears to be no swelling or redness noted. Next, I'm going to assess your skin trigger. I'm just going to try and gently pull your shirt to the side here. I'm going to pinch you. No tenting noted, and patient has good elastic recoil. On the hand here, we're going to do it. No tenting, good elastic recoil, no concern for dehydration there. Next, we're going to move on to your neck, okay? I just want you to look straight at me. Neck is symmetrical. The trachea is midline. Go ahead and swallow for me. Hyoid cartilage moves with swallowing. I'm going to have you kind of just rotate your neck around. Good. Patient has good range of motion of her neck. I'm going to go ahead and have you turn towards the camera here. We're going to assess your thyroid. I'm going to stand behind you here, gently touch you, and go ahead and swallow. Patient's thyroid appears to be appropriate size and shape. There is no enlargement. I did not feel any lumps, bumps, or nodules. Did you have any tenderness when you were doing that? Good. Next, we're going to move on to your lymph nodes. I'm going to use the 3 pads of my fingers, and we're going to start with your preauricle. Just let me know if you have any tenderness. Postauricle, tonsillar, submandibular, submental, anterior cervical, posterior cervical. Go ahead and turn your head. Deep cervical, which I'm unable to palpate. And then we're going to assess supraclavicular. Good. Any tenderness? There was no nodules noted upon examination. Next, I'm going to auscultate your temporal arteries over your eyes and your thyroid for any type of bruise. No bruise noted. Next, we're going to move on to your eye exam, Abby, okay? We're going to do a visual acuity using the Snellen chart. I'm going to have you cover your right eye. And I want you to read this line of text if you're able to.
D-E-F-P-O-T-E-C.
Good. Go ahead and cover your other eye. Are you able to read the line of text below it?
No.
No? Okay, then move up one line.
D-E-F-P-O-T-E-C.
Good. And then with both eyes open?
L-E-F-O-D-P-C-T.
Good. 20/20 vision. Next, we're going to move on to a confrontation test. I'm going to go ahead and have you cover your left eye. I'm going to close my eye, and I just want you to tell me how many fingers I'm holding up and when you see it.
2.
Good.
1.
Good. Go ahead and do the other side.
3.
Good.
4.
Good. Next, I'm going to inspect and palpate your eyes and eyebrows. Eyebrows appear to be symmetrical. They are brown. The eyelids are, there is no redness, swelling, or ptosis noted. Any tenderness?
No.
Good. I'm also going to feel below your eyes right here. Any tenderness?
No.
Good. I'm going to assess your lacrimal ducts here. Good. No swelling or discharge noted. I'm going to gently pull down here and look at your conjunctiva and your sclera. Sclera is white, conjunctiva is pink with no redness, swelling, discharge, or foreign body objects noted. We're going to continue with your eyes using this right here. I'm going to kind of have you angle towards the camera. I'm going to assess your cornea. Cornea is clear. Cornea is clear. There is no presence of a corneal arcus noted. The irides are hazel. And then I'm just going to kind of bring my pen light in. Follow the pen light from my nose to your nose without moving your head. Good. One more time. Good. Pupils are equal, round, reactive to light and accommodation. There was no nystagmus or pupillary defects noted. We already assessed your lacrimal glands, so we're going to do your extraocular muscles. I'm going to have you just look straight at me. Patient has the presence of a corneal light reflex. We're going to do the cover-uncover test, so go ahead and cover your left eye. Uncover. Good. Other side. And uncover. Both pupils are reactive. Next, we're going to do your 6 cardinal fields of vision. I want you to follow my finger without moving your neck. Good. Extraocular muscles are intact. Next, we're going to use the ophthalmoscope here. I'm going to be looking inside your eye. So I'm going to go ahead and turn this on. Just look straight at me. There is a presence of a red light reflex. The optic disc is visual. The macula is slightly oval and yellow in color. There is no presence of cotton wool spots. The veins are larger than the arteries. I'm going to check the other side. Other side, there are no lesions noted. The deep anterior chamber is appropriate for a patient. Next, we're going to move on to your ears. We're going to do an inspection here. Ears appear to be symmetrical. The pinna is symmetrical to the outer canthus of the eye. I'm going to go ahead and touch you here. Any pain or tenderness?
No.
No pain or tenderness, lesions, nodules, lumps, or bumps noted. Next, we're going to move on to the otoscope here. I'm going to go ahead and have you turn towards the camera. I'm gonna look inside your ear, gently pulling up on the pinna, and I'm gonna brace myself here, okay? I am able to visualize the patient's tympanic membrane. It is pearly white. I am able to visualize the malleus. The tympanic membrane is translucent. The ear canal does appear to have some cerumen and hairs in it, but is otherwise clear of any foreign body substances. Gonna look at the other side here. Gonna gently pull up here, look inside. There is cerumen in this patient's ear canal. The tympanic membrane is intact, translucent, and pearly white. There are no foreign body objects, lesions, or swelling or discharge noted. Next, we're gonna move on to your hearing exam, okay? I'm gonna use this tuning fork right here. I'm going to strike it, place it against your forehead. I want you to let me know what ear you hear it in.
Both.
Good. We're gonna do a rind test next. This, I'm gonna strike it, place it against your mastoid bone. Let me know when you're no longer able to hear it.
Can't hear it.
And then let me know if you hear it.
Yep.
Good. We're gonna do it again on the other side. Let me know when you're no longer able to hear it.
Can't hear it. You can hear it.
Good. Auditory conduction is greater than bone conduction. Finally, for the hearing exam, I'm gonna have you turn your head one way, cover your ear, and I'm gonna whisper something, and I want you to tell me what I say.
School.
Good. Other side.
Apple.
Good. No concern or abnormality with hearing exam. Next, we're gonna look at your nose. Your nose appears to be symmetrical. It is appropriate size, shape, and color for your race and ethnicity. I'm gonna go ahead and palpate it here. Let me know if you have any pain or tenderness.
No. No.
Good. No pain, tenderness, or bone/cartilage displacement noted. I'm gonna look inside your nares here using the otoscope. Nares are pink, slightly moist. There's no redness, swelling, or foreign body object noted. Other side here, nares are pink, moist, no septal deviation. Patient does have a nostril piercing, and I am able to visualize it. There is no redness or swelling noted on the interior nasal cavity. Okay, sorry about that. We had a small technical difficulty. We're gonna finish our assessment with mouth and throat. We're gonna begin with patient's lips. Her lips are symmetrical. They are pink, moist, and intact. Abby, go ahead and open your mouth for me. Patient has good dentition. There is no loose or broken or missing teeth. Patient's buccal mucosa is pink, moist, and intact with no lesions noted. Patient's tongue is pink, moist, intact. Go ahead and lift. There are no lesions or ulcers noted underneath the tongue. Go ahead and stick your tongue out for me. Patient's hard palate is atraumatic. The soft palate has no lesions, ulcerations noted. Go ah. Patient's uvula is midline. There is no redness or swelling noted, and the patient's tonsils are well visualized with no lesions, swelling, or redness noted. To conclude our assessment, Abby, we're going to go ahead and do a gag reflex. And the patient has a positive gag reflex. Thank you so much for your time today. I really appreciate it. If you have any questions, give me a call.
Okay.